Good afternoon, everyone, or good morning, depending on your time zone. Welcome to this week's session of Integrity Data's ACA Summer Educational Series. We recognize your time is valuable, and we sincerely thank you for joining us this afternoon. I'm Shelley Austin, Customer Engagement Manager at Integrity Data. Joining me also on the webinar is Gary Schmidt, Customer Care Representative. We will be answering questions at the end of this webinar, so please feel free to submit your questions at any time throughout the session. We do have everyone on mute, but if you need any clarification, please let us know through the questions field in your GoToWebinar panel. So let's go ahead and get started. As many of you know, the Affordable Care Act has proven to be a confusing piece of legislation, especially for employers, because employer responsibilities under the ACA employer mandate are often unclear. So our 5-part 201 webinar series aims to help employers understand this employer mandate and be clear on what it means for them. Our goal in this third webinar is to give you some helpful guidelines for determining when an employee is eligible for health coverage. So very quickly, who is Integrity Data? Integrity Data provides solutions to improve business processes for payroll and human capital management, including simplifying Affordable Care Act tracking and reporting, enhancing Microsoft Dynamics GP payroll, and supporting employee financial wellness. Celebrating over 20 years in business and serving over 10,000 organizations, your people are our priority. All right, so cooperating with Affordable Care Act employer compliance requires preparation. So we've organized this preparation into 3 pillars. The first one is eligibility determination, which is what we are talking about today. We'll discuss the following 2 pillars in our final webinars, which are deciding on a pay or play strategy and record keeping for the required IRS reporting. Remember, all steps toward compliance are connected, so choices you make for one do affect another. This cycle never ends. It is a continuous process year after year. So let's go ahead and dive into eligibility determination. So quick recap from previous webinars. An employee is eligible for health coverage when they are full-time employee as defined by the Affordable Care Act. The ACA has redefined the full-time employee definition by abandoning the concept of a 40-hour work week to be classified as a full-time employee and reducing that threshold to 30 hours a week, and by increasing the hours that need to be tracked when crediting employees with hours of service. We've hosted a 201 webinar on guidelines for classifying an employee as full-time and how hours of service play into that, highlighting some complex situations. If you missed this, please check our education site at www.integrity-data.com/ACA-201 to view the recording. And also, if I did not mention at the beginning of this webinar, the recording of today's session will be available on our website within the next 24 hours. Okay, so now that you know how the ACA defines full-time employee, you need to make a decision on how to measure that full-time status so you know when an employee is eligible for health coverage. The ACA allows 2 methods to be used to determine when an employee is classified as full-time eligible under the ACA, the monthly or the look-back measurement method. The monthly measurement method requires that the employer count an employee's hours of service for each month in a calendar year. The employer must then treat an employee as being full-time for coverage purposes for any month in which the employee's hours of service total 130. This method is best suited for companies with predominantly salaried workers because these employees would be classified as full-time from the beginning. There would be no benefit in having a look-back measurement period. If you adopt this method for your part-time employees, you should be certain to have tight controls on their work schedules. The other method is the look-back measurement method. This method allows an employer to determine the status of an employee as full-time during a future period, referred to as the stability period. based upon the employee's hours of service in a prior period, referred to as the measurement period. This is the preferred method because it establishes a testing period where eligibility is determined not based on a single month, but on average weekly hours over a period of no less than 3 months and no more than 12 months. It allows a smoothing of hours, which might spike 1 month to over 130, but remain well under 130 the rest of the months. The Integrity Data ACA compliance solution only supports the look-back measurement method. The look-back measurement method testing is continuous. When one measurement period ends, another begins. We are going to spend a few minutes diving into the look-back measurement method on the next slides. So the look-back measurement period is established by the employer. This period can be up to 12 consecutive months, but no less than 3 months. This is a testing period that looks back on the previous year or split years to determine an employee's eligibility. The stability period can be no less than 6 months. With this measurement method, testing for eligibility is not dependent on just 1 month, but it looks at several months within what is called the measurement period to see if in each month of that measurement period, the employee averaged 130 hours. This spreads any special circumstances, so special projects, filling in for another employee, etc., over a period of time. It smooths out peaks and valleys. So the benefit of using this measurement method is that the employee has to work the entire testing cycle and has to average 130 hours or 30 hours or more per week in each month of the measurement period. So regardless of the hours they work during the stability period, some companies view having to offer coverage to the eligible employee during that period as a drawback. But that's really not the case. In reality, if an employer was on a monthly measurement method, the employee would have been eligible much earlier. The look-back measurement method is commonly used by companies with part-time and hourly workers. And the next slides will go deeper into this look-back measurement method. So ongoing variable hour employees are tested in a standard measurement period. In order to be tested, the employee must work the entire testing period. Statistically, the longer the testing period, the more accurate the data in determining eligibility. So for companies with high turnover rates, 12-month measurement periods often eliminate many employees from eligibility determination. They would be considered full-time eligible only in the corresponding stability period for that test. Continued eligibility during the next stability period would require them to pass the corresponding standard measurement period test. So under the look-back measurement method, variable hour employees are continuously being tested for eligibility. So as I mentioned before, when one measurement period ends, another one begins. These consecutive testing cycles raise some new challenges. So eligibility is now much like a light switch. It can turn off and on. An employee testing eligible in one period may not test eligible in the next period, thereby forcing an employer to make a determination of whether or not to cancel coverage. Remember that the ACA defines who must be offered coverage. Employers can choose to offer coverage to an expanded pool if they want to. A variable hour employee who tests eligible for health coverage in a testing period does not require a reclassification from variable hour to full-time. All it means is that in the testing period, they became eligible. They happen to work enough hours. That does not mean that they are guaranteed to work the same number of hours going forward. Now what happens when a variable hour employee start date is not on the first day of a standard measurement period? Obviously, this is not unusual. So in those cases, they will always work in an initial measurement period, which is tied to their start date. Like the criteria for standard measurement period testing, an employee must work the entire initial measurement period to be tested. Note that in initial measurement periods, the administrative period is limited. Unlike a standard measurement period that can have up to 3 months for an admin period, in an initial measurement period, the combined totals of the measurement and administrative period cannot exceed 13 months. Stability period must be the same in standard measurement period and initial measurement periods. If not, there will appear gaps in coverage as they transition from the initial measurement period test to a standard measurement period test. So for variable hour employees that will continue employment, there will be a transition period where they move from an initial period to a standard measurement period testing. In the graph, you will see that there is a time at the end of the employee's initial measurement period that the same hours will be used for both the initial measurement and the standard measurement period testing. Even if employee does not test eligible their first complete standard measurement period, if they had previously tested eligible in their initial measurement period, the employer must honor the stability period associated with the initial measurement period test. This means that companies have an added burden of managing stability periods and knowing when each employee will exhaust their eligibility. Our ACE solution has a stability period management report that will highlight employees and show when their stability period will end, whether it be an initial measurement stability period or a standard measurement stability period. You can also look at one of our KB articles. It's 14-044 on the Integrity Data website for further explanation on this. This is just a quick reminder that we will be addressing your questions at the end of this webinar, so please feel free to submit those at any time. So let's talk about a few special rules around employment status changes. If an employee changes classification from full-time to part-time, they must be tested as if they were a variable hour employee from the very beginning. They must be tested in the last testing period they would have been eligible for to determine if they would continue to be classified as being eligible for coverage. If the employee did not work enough time to be tested in any measurement period, their coverage must be extended until a testing period is met, so determination can be made. Once the move is made, the employee will be tested as any other variable hour employee, and eligibility for continued coverage will be based on those test results. Going from part-time to full-time mirrors the same rules of hiring a new employee as full-time. A company must offer health coverage no later than the first day after the employee's first 3 full months working in the new classification. For an example, an employee starts on June 10th. This means that they must be offered coverage October 1st. When we say first day after the employee's first 3 full months, and which also is the criteria for newly hired full-time employees, we are referring to the non-assessment period that is provided within the ACA. This should not be confused with your internal waiting period policies. The ACA gives you this non-assessment period, which you generally take when submitting your yearly reporting on who was eligible by month. The rules for when you can classify a returning employee as a new hire under the ACA, the so-called break-in service rules, have been tightened. They apply to both the look-back and the monthly measurement methods. So a returning employee can be classified as a new hire provided that 1, they had a break-in service for 13 consecutive weeks if the employer is not an educational institution, 2, had a break-in service for 26 consecutive weeks if the employer is an educational institution, or 3, had previously been employed for at least 4 weeks and their absence of service was greater than their previous service. This is also referred to as the rule of parity. The important thing to know is that determining whether an employee is a new hire under these rules is at the sole discretion of the employer. An employer might not want to reclassify a returning employee as a rehire and keep them in the current measurement period. The theory here being that if they were absent for an extended period, they would not accumulate enough hours to be classified as full-time. There are no non-discrimination rules here, and employers do not have to adopt a universal policy that applies to all. 2 employees can leave on the same date, both can return 14 weeks later on the same date, and the employer could choose to classify one as a rehire and the other as a continuing employee with no adjustment made to their hire date. The ACA rehire rules do not affect other areas of a company's benefits. They are limited solely to health benefits. The challenging part comes when you rehire employees that, if they had remained employed, would have been in a stability period. Any employee who returns to service during a stability period in which they were previously entitled to must be offered coverage that would fulfill the stability period. The good news is that the employer has until the first day after the employee's first 3 full months after return to have them signed up. So here's a few examples. An employee was in a stability period from January 1, 2018 to December 31st, 2018. The employee took coverage and left the company on March 2nd, 2018. Then the employee decides to return on June 2nd, 2018. The company must now offer continued coverage no later than October 1st, 2018. The company can then terminate the coverage on December 31st, 2018, which would have been the end of their initial stability period, and wait until the initial measurement period test results if this is a variable hour employee. So just a reminder that we will be transitioning also, again, into our Q&A portion of the webinar. So if you have your questions ready, you can submit them in the side panel. So obviously this webinar covers only part of the ACA complexity. There is so much more to learn. Please make sure to visit acafluent.com for more educational resources. Here's a few other options. You can watch our 101 educational videos that cover whether you have to comply, how to comply, and penalty details. Also, each video from the 201 educational series will be available for on-demand viewing. You can download our ebook, Employer Essentials for IRS Reporting, and our printable infographic ACA checklist for 2018 reporting. Our website also has quick links to IRS resources if you would like to hear it straight from the source. And you should also think about accessing our blog feed as it continually updates with new hot topics. Here are our upcoming webinar topics and dates. So don't forget to register at integrity-data.com/ACA-201. Be sure to visit the page after each session for previous recordings and slide decks. And also, just for more information about our solution offerings, you can always visit our website again, which is integrity-data.com/ACA. So let's go ahead and transition into our Q&A. As I mentioned earlier, we have Gary on the line. Gary, did we have any questions today?
Nope, not at this point, anyway.
Okay. We'll give you guys just a few minutes. If you do, of course, it's not required, but we are here to answer any burning questions. But if you can't think of any right now, please feel free to email us after this webinar, and our customer care team would be happy to address any questions at that time. Okay, well, there are not any questions coming in. So we are very happy that you decided to join us today. We certainly hope that you found this presentation informative and helpful. Again, please feel free to contact us via email with any questions or concerns. And we definitely look forward to speaking with you during the next session. Have a great rest of your day.